I'm Andrew Falzon. From medication and machines to the special needs of women and kids, how science may help you get a better night's sleep. Science and You starts right now.
I'm Donna Hanover. If you've ever had trouble falling asleep, and who hasn't, we'll take you to the kind of sleep clinic that might help. That's ahead on Science and You.
I'm Carol Ann Riddell. All of us need sleep, but for some people with sleep disorders, getting into bed doesn't necessarily mean staying there. Today, a closer look at sleepwalking, ahead on Science and You.
We all want it, but some of us need a little extra help getting that good night's sleep. With all the over-the-counter and prescription medications that are available, which one is right for you? We'll help you sort it out, coming up on Science and You.
Hi, I'm TINABETH. Research shows that women suffer from more sleepless nights than men. We'll find out why ahead on Science and You.
I'm MAGALIE LAGUERRE-WILKINSON. Often when a child can't sleep, it means a rough night for the entire family. We'll show you a place where medical experts get together to make sure your child can get a good night's rest. That's ahead on Science and You.
I'm Donna Hanover. Getting to sleep is a big problem for millions of people. Some turn to sleep clinics like the Sleepwell Center here in Madison, New Jersey, to find out how serious their sleep disorder is and what to do about it. Cameras allow technicians to monitor the sleep of patients like Ron Cortez, who arrived to spend the night in one of several comfy bedrooms in hopes of finding out what's causing their sleep issues.
I've been having a hard time falling to sleep or not sleeping very well. The rapid weight gain, feeling tired throughout the day.
Ron was told by his physician that he should be tested for sleep apnea, where people actually stop breathing in their sleep and wake up repeatedly to get oxygen, usually without even knowing it happened. The medical director of the Sleepwell Center is Dr. Mark Benton, who's seen people with everything from sleepwalking to restless leg syndrome, from insomnia to narcolepsy. But sleep apnea is one of the most prevalent disorders he treats. These patients are in much greater danger than people who get a normal night's sleep.
People who have sleep apnea are more likely to have strokes. They're more likely to have heart attacks, develop heart failure, have abnormal heart rhythms, and including heart rhythms that can be malignant or fatal. And people who have sleep apnea are much more likely to have perioperative complications.
During his night in the clinic, Ron was hooked up to have various functions measured. Soon after his stay, his results were collated by the Director of Sleep Services, Neil Friedman.
These are the eye movements, the chin, so we can see the chin muscle activity, the brain waves, the EKG, the snoring. This is a snore mic that's applied to the throat, and that's it's picking up a visual snore, and we're also hearing through a regular mic, we're hearing the auditory snore.
Okay, so this is the deep sleep period for Ron?
Right here, N3, he's in deep sleep, yes.
And what's happening?
Well, he's having some respiratory events. Here's a hypopnea where he went from 96%, his oxygen supply went from 96% to 90%. That's a significant drop. And at the end of it, you can see he has had an arousal. He woke up.
So he couldn't breathe, and therefore his body woke him up?
Correct, correct. And this essentially is going on all night.
Now, Ron thought it took him a long time to fall asleep here.
Right.
Did it take him a long time to fall asleep?
No, it took him approximately 2.5 minutes.
The human sleep cycle starts with 2 lighter stages of sleep, then deep wave sleep, which is restorative, then rapid eye movement or REM sleep, which is when we dream and consolidate our memories. The cycle is repeated with slight variations several times each night. When Ron met with Dr. Benton to review the test, he learned that his apnea is most severe during REM, explaining his trouble remembering things, but that the apnea is significant all night.
How many times do you think you stop breathing and then have a little awakening each hour?
Well, in the past, I always thought about 2 to 3 times a night.
Try 73 times an hour.
Per hour?
Per hour, not per night.
Wow.
Now, what causes this is anything that contributes to narrowing of the airway. Weight is a big issue, and a lot of it has to do not just with weight, but how your weight is distributed. People who have wide necks, people who have short necks, people who have very big tonsils, people who have recessed jaws or overbites. These are all people who are much higher risk for having sleep apnea. However, if I just tell you to lose weight and come back and see me in 3 months, you're not likely to do it. It's going to be an almost impossible task unless we do something about the sleep apnea.
When a person is found to have sleep apnea, there are several therapies to be considered. For very mild cases, doctors suggest trying to not sleep on the back, as that position more readily blocks the airway. A second option, surgery to reduce the blockage in the back of the throat, is very complex. Weight loss may help. A dental mouth guard to hold the lower jaw forward works for some people. But if the diagnosis is severe sleep apnea, patients often start using a CPAP machine.
Now, this is a CPAP machine. CPAP stands for continuous positive airway pressure. And it's going to deliver room air under a higher pressure through this mask, which are called nasal pillows. And this air is going to come through the pillows. You're going to have this in your nose. I want you to just nestle it into your nose up to this ridge. The ridge is going to seal your nose from the outside. And then I'm going to turn it on.
What is happening?
What's happening is you're getting this forced air, and it's keeping your airway open so it doesn't collapse.
And CPAP is Dr. Benton's recommendation to Ron.
As you go to sleep, we start pushing pressure through the mask in order to alleviate the snoring, open up the airway, get rid of the irregular breathing, and normalize your sleep routine. And the improvement that people see with this type of treatment is dramatic. And it's usually fairly immediate. We start you on CPAP and you go from waking up 72 or 3 times an hour to waking up once or twice or 3 times an hour. You notice it. It means that you're going to wake up in the morning feeling better.
Starting treatment will involve a second night at the clinic to figure out the right CPAP machine, mask, and air pressure. The newer machines record feedback at home so doctors can see how to make the settings most helpful to the patient over the long term. After the meeting with Dr. Benton, Ron headed home to spend the evening with his 2 sons, Cameron and Christopher. He said his wife, Rosemary, was actually relieved with the results of the sleep study.
And she felt, it's like, great, you know, we have an answer.
Did your children give you any kind of motivation to want to deal with this issue?
Well, absolutely. I was thinking about Reggie White, the NFL Hall of Famer who passed away at 43, and they said sleep apnea was a direct cause of that. He had caused him to have a heart condition, and I thought the same thing too. My father passed away from a stroke. My boys are young. I want to be there when they're older.
So there is help for many people experiencing sleep disorders, and it's vital to get help so that you can be alert during waking hours. Many patients say finding the solution to a sleep disorder is like a dream come true. I'm Donna Hanover for Science and You.
I'm Carol Ann Riddell. If you've ever seen someone sleepwalk or even experienced it yourself, you know how unsettling that can feel. But what's behind those nighttime wanderings, and what can you do about it? Take a look. College student Shira Spiel was just a child when she had her first experience with sleepwalking.
I remember walking down the stairs, and I remember being aware of my surroundings enough to hold onto the banister and walking slowly. And I walk up to my dad, who was still awake, and I just stood there looking at him.
More recently, Shira says she found herself in a hallway outside the dorm room she shared with roommates, dressed in her pajamas.
I was in my dorm room, and it was the 3 of us, and apparently I got up and bolted out of the dorm room, and I was still in pajamas, and it took me 5 minutes to close the door because the door was sticky, and eventually I slammed it, which woke me up, and I realized I was in the hallway.
So in that case, you found yourself outside in the hallway? Yeah. Did you know how you had gotten there?
No.
Dr. Kanta Ahmed, who specializes in sleep disorders medicine at Winthrop University Hospital in Mineola, New York, explains the prevalence of sleepwalking is about 4% in adults and higher among children, about 17%. She says sleepwalking is a type of parasomnia, a behavior that emerges from sleep, and those behaviors can vary on a spectrum and be complex, either occurring in deep sleep or in some cases during the dream sleep.
Events that happen in the first third of the night are very likely to be slow-wave sleep-related parasomnias, and they may involve any number of events with the same patient. So this patient could be sleep talking, they could be sort of mumbling in their sleep or kind of moving around a little bit, or leaving the bed and wandering around and then finding that the door is locked, for instance. The other kind of parasomnias are called dream sleep-related parasomnias, and these can be very troubling. I had a patient just yesterday, I think it was, who had described dreaming of choking an intruder and had woken up to discover he was choking his wife.
Sleep medicine staffers at Winthrop's Sleep Disorders Center gave us a behind-the-scenes look at how sleep studies are conducted, one of the steps in diagnosing and treating people with sleep problems.
The limb leads, the muscle tone, and the leads on the brain are very important. The diagnosis can't be made without that.
All of the patient rooms are equipped with cameras and microphones, so everything that happens in here can easily be monitored by the technicians watching from the outside.
Ultimately, doctors end up with a study that shows clearly what a patient experienced overnight. Watch this video closely. You'll see a patient with a parasomnia emerging from dream sleep. Dr. Ahmed says there are many factors that can trigger parasomnias, including sleepwalking. For example, acute and chronic sleep deprivation, alcohol intake with or without excess intake, disruption in sleep routines like jet lag or change in shifts, and some sleep aids.
In some instances, we actually meet people who've had injuries related to sleep. They wake up and they have bruised themselves or sometimes even fractured ribs and fractured noses related to sleepwalking.
So what should you do if you have a sleepwalker in the house? For starters, safeguard the sleeping area.
I asked my patients to go back to their bedroom and imagine that they were protecting a child that was sleepwalking and remove what they think could be dangerous.
Bottom line, sleepwalking is not a reason to panic, but it can be serious and in some cases dangerous. So it's a good idea to talk to your doctor. I'm Carol Ann Riddell for Science and You.
Why do people go to sleep?
So a person goes to sleep because there is a group of cells in the center of the brain, okay? That place of the brain is the hypothalamus. There is a nucleus, a group of cells there that is called the suprachiasmatic nucleus. That nucleus is sensitive to light. Light comes through the eyes, through the nerves, all right, and then end up impressing upon this suprachiasmatic nucleus. This nucleus then wakes up a pineal gland, a gland that we have also in the center of the brain, and that pineal gland starts secreting melatonin.
I'm Andrew Falzon. We've all had those sleepless nights, trying absolutely anything to get to sleep, counting sheep, maybe a warm glass of milk. Today we've come to the Sleep Disorder Center at Winthrop University Hospital in Garden City, Long Island, to find out which sleep medications can help get your sleep schedule back on track. Dr. Michael Weinstein takes sleep very seriously. He's spent nearly a decade and a half helping patients with sleep problems. Do patients seem a little bit more willing nowadays to have that prescription help them with their sleep?
Many patients do have an expectation that they need a sleeping pill,
okay,
that they need a sleeping aid. What I think our task is to try to look at them in their totality and to determine whether they really do need a sleeping aid or whether the problem lies someplace else.
The Food and Drug Administration regulates all prescription drugs and says there are at least 14 different prescription medications that can be used to help you get a better night's sleep. Many trace their origins back to Valium as part of a group of drugs called benzodiazepines.
Chemically, they're actually quite similar. The differences, the important differences relate really to how long the medications act. So, for example, if a patient only has difficulty getting to sleep, then you don't necessarily need something that lasts until 5, 6 in the morning. You just need something to get them over that hump.
According to the National Sleep Foundation, nearly 48% of Americans complain of occasional insomnia, which is the medical term for not being able to fall asleep. Dr. Weinstein says the sleep prescription that most patients ask for is Ambien, which also goes by the generic name Zolpidem. Who is Ambien for, and how does it work?
Ambien, as I said, has an intermediate duration of action. It'll get you through a reasonable duration of the night. All of the sleeping aids have some potential for causing a hangover in the morning, so you have to take that into account. You have to take into account what time a patient is waking up.
Which means using any prescription sleep aid requires a full night's sleep, usually 7 to 8 hours. Dr. Weinstein warns that a certain age group may want to avoid Ambien as well.
The risk of getting up during the night has to be taken into account. The risk of falls, for example, may be increased in elderly patients. So it may not be a very good choice for an older patient. You'd want to use the lowest dose possible.
Dr. Weinstein says another prescription option is Sonata, which doesn't last as long as Ambien and works well for patients who have trouble just falling asleep but no problem staying asleep. Another option is Lunesta, which lasts as long as Ambien, but some users report a rather unique side effect.
In some patients, Lunesta has some side effects that patients sometimes note, such as bad taste in the mouth. Again, it's not all patients, but if you're one of those patients, it's unpleasant.
There are also sleep medications that are available without a prescription. Dr. Shaline Chawla has been a board-certified sleep specialist for the past 10 years, but is hesitant to recommend an over-the-counter option.
I think most physicians, allopathic physicians, aren't comfortable. I think because they're not regulated by the FDA, you don't know if you're getting the same milligrams in each tablet, because there is no regulation. And we don't necessarily know the side effects of those medications till later. You hear later on case reports that there were these issues, or medications were pulled off the market because of side effects.
Despite her concerns, Dr. Chawla says that melatonin is one over-the-counter sleep aid that has been studied long enough to safely use under a doctor's care.
We're moving towards using it for older patients because it doesn't really have such a side effect profile.
Dr. Chawla also says that sometimes the best medication can be good sleep habits. She recommends removing distractions like TV and computers from the bedroom. Don't read in bed if you have insomnia. Try to wake up and go to sleep at the same time each night. Don't exercise too close to bedtime, and don't consume caffeine after lunchtime or nicotine before bedtime. So the next time you walk down the aisles of your local pharmacy, you'll have a better idea of how to navigate through all those sleep aids and sleep medications. And remember, whenever you try a new medication, it's always a good idea to consult with your doctor first, whether it's over-the-counter, prescription, or all natural. I'm Andrew Falzon for Science and You. What happens to people in REM period sleep?
When you are in the REM period, the brain physiologically behaves as if it is awake. It's moving back and forth, it's doing all sorts of things that it needs to do. And the brain waves, you see that you can measure those brain waves, they are very rapid. It's like you are awake during that time. However, you are fast asleep. Not only are you asleep, but the muscles, the voluntary muscles, are somewhat paralyzed. They can't move. You can't move. So you won't act up your dreams. That part of the sleep, the REM sleep, is when you dream usually. So you think about things, you see images, you think that you're speaking to people. It's like you think you're running, you think that you are doing flying, you think that you are doing all sorts of things, and at the same time you are paralyzed, you cannot act them out.
Hi, I'm TINABETH PINA. Getting the right amount of sleep is as vital to your health as the quality of your rest. And according to the National Sleep Foundation, for women, finding the right balance can be tricky.
Insomnia, for sure, is the most common reason that women present to sleep centers. Some sleep centers say that 80% of their insomnia patients are women, basically. So that's number one. Probably, though, the most interesting ones are, for example, eating disorders. So women who wake up in the middle of the night, don't even know what they're doing, go to the refrigerator, start eating, and then wake up in the morning, they have ice cream stains all over their nightshirt, and they don't know why, they don't even remember. That's much more common in women, and we don't know why. The restless legs, where women just have to keep moving the legs and can't sleep because of that, or during the sleep, move the legs, may be a problem with iron levels, ferritin levels, folate levels. Again, you start to think about what women go through, such as pregnancy, that may predispose to that.
Research has shown that a woman's sleep cycle is more often than not affected during hormonal changes that occur in her body while going through menopause, her menstrual cycle, and pregnancy.
Pregnancy seems to be a trigger for insomnia, so women who have slept well before they get pregnant, during pregnancy, and particularly the last trimester, just have a terrible time falling asleep. Also, breathing disorders are more common in the last trimester with women, and so sleep apnea, snoring, and disruptions because of that tend to occur in women who are pregnant in the last trimester.
When I was pregnant, I was so tired. I really felt it was just so, I was so happy when I found that I was pregnant, because then I realized that I wasn't ill, that all of the things that were going on was something that the baby needed, and that I would have to give, whether I wanted to or not, whether I had the time or not, it was going to be given, regardless of how I felt about it. And my sleep patterns changed immensely.
Sleep issues can also be a problem during a woman's menstrual cycle.
When you have your menses, you generally have pain, and that's very disruptive too. It's not quite clear how the circadian cycle changes with that, but it's more of really just a physical sense of just feeling poorly and not being able to sleep and being sleep disrupted.
Whenever I have my menstrual cycle, I need that rest, or I feel that I will crumble.
Once a woman is out of her reproductive years, menopause sets in, and that can affect sleep more than any other period in a woman's life.
Sleep apnea gets more common after that, and there are two basic reasons for that. One is that women who are menopausal tend to put on abdominal fat, and that abdominal fat causes all sorts of problems with sleep and health. The other thing, there's a clear hormonal component. So when you become menopausal, your estrogen and progesterone levels go down, and that affects, again, how you control your rhythms and how you may be comfortable sleeping. Not to mention, again, that will predispose to breathing disorders in sleep, particularly the loss of progesterone, we believe, will decrease your ability to breathe normally in sleep and to control your breathing normally.
And sometimes for women, a sleepless night might not be hormonal at all.
Sleep apnea, in that it's more common in men, but you know, the man that the woman is sleeping next to is doing that all night, and that's much more of a problem for the woman than it is for the man in terms of the noise and staying awake.
But there are things that can be done to help women improve their sleep.
We don't really think the first thing you should do is take medication or pills or sleeping pills, but rather to examine what's going on. So first of all, the environment. So a cool environment, generally a quiet environment, a dark environment. Protecting your sleep time, cherishing your sleep time, so there's a time when you should be asleep. So regularity is another key. Don't lay awake in bed ruminating and worrying. So if you're awake in bed for more than 30 minutes or so, you should get up and get out of bed, go into another room if you can, and do something very boring. Don't turn on lights, because lights will reset your rhythm and wake you up again. Obviously, smoking and caffeine are bad for sleeping, so cutting down on those things. Women tend to have more acid reflux than men, and sometimes sleeping problems with women are as simple as just treating some syndromes such as acid reflux or even pain syndromes. So these are things also that women can concentrate on, but really these are good sleep hygiene tips for anybody who wants to get a good night's sleep.
Researchers at Duke University have recently found that sleep-deprived women are at an elevated risk for heart disease, type 2 diabetes, and depression. I'm TINABETH PINA for Science and You.
Parents typically lose between 400 to 750 hours of sleep during the first year of their baby's life.
I'm Magalie LaGuerre-Wilkinson at the Sleep Disorder Center at the Children's Hospital at Montefiore in the Bronx. This is the place where experts get together to focus on just one thing: unlocking the secrets behind the science of a good night's sleep. The Sleep Disorder Center at Children's Hospital at Montefiore is the only full-service sleep lab in the New York metropolitan area dedicated exclusively to children. Doctors here say sleep issues in children can lead to serious, sometimes dangerous problems.
I would say sleep disorder in a child could really lead to a disruptive physiological consequences, particularly in his behavior, learning capability, concentration in school, but also long-term incapacitation of our cardiovascular system.
Lifestyle can also lead to problems, according to Dr. Ahrens, with kids today trying to keep up with popular culture, and yes, even school.
Today in schools, people are very competitive, get a lot of homework, they stay up late to do their homework, but in addition, they have a lot of distractions, particularly phone calls, computers, internet, cell phones, and so forth. All these disrupt their capability to maintain a regular sleep-wake schedule.
For children with more serious, even life-threatening sleep problems, the Sleep Center can monitor them through the night, recording breathing patterns and changes in heart rates. This data allows experts to determine the severity of the problem. 11-year-old Deja Bethel has been diagnosed with sleep apnea, a disruptive breathing problem that causes her to awake abruptly numerous times during the night. She'll be monitored by Dr. Ronan Ahrens and his sleep lab team in an effort to find a restful solution to her problem. When they come to the Sleep Center, tell me a little bit what the process is. They come, and then what's the treatment? How do you fix this?
We would like to know in their history the sleep-wake schedule. How do they maintain a schedule on the weekdays and weekends? Because that's something we could try to correct if we explain it to them. We talk to them about nutrition. Overweight is a problem of intake and output. So it's very important that teenagers today and youngsters pay attention to what they eat and how much they eat, and what they drink and how much they drink. We talk about beverages, sodas, and juices. That's something that's easy to cut out or to reduce. Once we refer them to the sleep lab, and we have the diagnosis, and we know the severity of the disorder, we try to address each of the problems that this patient exhibits.
One basic discipline Dr. Ahrens recommends is known as good sleep hygiene, where prior to sleep, a parent can create a very relaxing environment for the child by dimming the lights and giving a short warm bath, reading a favorite short story, and absolutely no TV or games. As for young Deja, her night in the sleep lab provided experts with an encouraging recipe for recovery. An uninterrupted night's sleep is not only good for the entire family, but it's also good for the overall health of a child. I'm Magalie LaGuerre-Wilkinson for Science and You.
That's our show for today. My name's Andrew Falzone. We'll see you next time right here on Science and You.